Hey, I'm Jeremy Waller, Marketing and Community Outreach Manager for Behavioral Health with Empower.
Hi, Jeremy. How are you doing today?
Doing great. How are you?
I'm well, thanks. So tell us a little bit about what Empower does.
Yeah, so we are a mental health, behavioral health, and child well-being nonprofit. Operate in about four different kind of areas. One, outpatient behavioral health through telehealth. Two, we have a 70-bed inpatient unit for teens that are struggling with substance abuse and misuse challenges called the Grove. Three, we have the Village, which is a transitional housing program for youth that have aged out of the foster system and that are borderline homeless or homeless. And then the last thing that we do, we have our hands kind of in adoptions, and then we do some prevention programs in school systems as well.
And how do these people get referred to you? How do they find out about you?
Yeah, traditional digital marketing, kind of what you would expect. We get a lot of word of mouth referrals through community partners throughout the state. We get a lot of referrals from other agencies. So good example would be, say there's a clinic that serves individuals and they don't have the bandwidth to do mental health services, or maybe it's a shelter, they don't do mental health, but they've identified that as a particular challenge. They'll refer them to us. We'll come in and step in and kind of bridge that mental health gap, we like to call it, through a lot of different agencies. If it's adoptions, we do a lot of work with partnering agencies in Brevard County. If it's, our school programs, we have partnerships with Seminole County Public Schools, Orange County Public Schools. Depending on where, for the Grove and Village, again, there are some self-referrals, but it can also be another agency. As far as how we get that word out, it's our website, social media, email marketing, some paid advertising. We operate statewide, so it's kind of a large swath to cover. But I would say, as far as marketing vehicles, pretty much what you would expect from a lot of organizations, but a bigger emphasis on community partners.
Wow, that's awesome. And so you said statewide, so all the way from Jacksonville to Miami.
Yeah, exactly.
Wow.
And don't forget Pensacola. So,
Yes.
it's because the majority of what we do, I mentioned we have kind of four buckets, but the majority of what we do is outpatient telehealth. We've been doing that for roughly 9 years now, about 1 million telehealth visits. So,
Wow.
it's kind of we kind of consider ourselves a pioneer in that regard in Florida for behavioral health virtually. So that obviously breaks down all kinds of barriers, so we can have a practitioner in Pensacola talking to a client in Miami. Absolutely.
Wow, that's incredible. So you kind of had a jump start on everyone's concerns during the pandemic of how you would service, your clients. So I guess my next question is, how did you have to pivot, during that, even though you did have telehealth,
Yeah.
or how did that affect
You
the
know,
nature
the,
of people calling in?
the pivot for us was different than a lot of organizations. It's always a weird thing when we say this. 2020 and into 2021 was a
Mm.
good year for us, unfortunately, just because people were so much in need. We saw a 48% increase for demand in services, for mental health services since the onset of the pandemic. We've seen our month over month numbers for outpatient and for clinic. They're averaging about 85% month over month per month so far this year. So the demand has been crazy. So what we've had to
Wow.
do is actually staff up. Remote, most of our organization was remote long before the pandemic. We do have some of us in admin office space every now and then, but most of us are, with about 180, 200 employees, almost all of us are remote. So that wasn't a challenge. The infrastructure wasn't a challenge for that, but it was definitely, okay, we have this influx of clients. We need to hire some more practitioners.
Mm.
That's actually how I got hired from the marketing and outreach side. Was we have a lot of things now we need to market. We need to do more marketing. We just don't have enough staff. We need to kind of beef up our department in that regard. So I would say, and that has challenges with it, right? Your classic HR things, onboarding and bringing new people on, and culture.
Right.
But really, I would say nothing. I would say it has not been as challenging for us, thankfully, as it's been for other organizations. But the downside is a lot of people needing help too. So, you kind of weigh both sides of it.
Yeah, absolutely. And what would you say would be the biggest, I guess, concern for people during the pandemic coming to you? What was the service that you think you were able to, give people the most?
Yeah, it's kind of tough to judge because we have the spectrum of behavioral health that we offer is wide. The diagnoses are wide. There's a lot of a lot of times you're treating someone with compounding illnesses or things going on, right? I feel anxious, but I also have depression, but I also have maybe something else going on. I would say probably, I can't identify one specific mental illness in particular or diagnoses that's been popular. It's a weird way to put it, but I think you just have a lot of people that don't have access to care where they're at. And especially in rural areas, obviously the telehealth really helps with that. But a lot of the challenge tends to be insurance is a challenge. Wait lists are a challenge with agencies a lot of times, and a lot of people are kind of overloaded right now. And I just don't have access where I'm at normally. So apart from that, just general outpatient has seen a massive surge, and that covers everything from medication management to substance abuse misuse to cognitive behavioral therapy. And the diagnoses under that are quite large. So it's been just a surge across the board, really.
And what would you say is the biggest stigma about reaching out for help, especially with, behavioral health?
Yeah, it's we always have this phrase too that the people that need the care most are the most reluctant to receive it. And it's kind of multifaceted. On one perspective, and I get it, there's kind of a distrust, especially even now, even after the pandemic, with mental health services, with just mental behavioral health in general. It has stigmas, right? Does it work? Is it really effective?
Right.
There's a lot of questions around that. That can be a barrier. But really, I think people just aren't comfortable talking about it. And it is an incredible, we're offering free services right now. We have a special grant through DCF to do that for people affected by COVID. And we're serving over 400 in the state, but even still, it can be hard to get people on board for even free services. A lot of times they're just scared, right? There's doubt, there's fear, whether it's telehealth or brick and mortar. When someone makes that first step to go into counseling, they've probably gone through 100 scenarios in their minds. They've probably prepped for months or maybe years to do that. So it is a huge deal internally as well. It's just not something people like to talk about. It's tough. And we have Mental Health Awareness Month coming up in a few days, and 1 in 4 people this year are going to be diagnosed with a mental illness, and that stat's been pretty stable for a while now. Wow. And when you think about that, there's not a lot of things you can point to where it's 1 in 4. So people have those fears. What if my workplace knows? What if my friends know? Will they think different about me? Will they just see me as this label? Will they not? It's hard. Again, it's hard to point to one thing, but there's just a lot of things going on. 1, I might be a little distrustful. 2, I've got a lot of internal conflicting things going on. I don't know if I'm ready. I want to take that step. I don't know. And then 3rd, what are other people going to think? And you could have, and I'll throw in a last one, and then I'll digress, but you could have a 4th thing where medication, side effects, right. What does that all entail? What is that even? Is
that going to leave me worse off than when I came in?
And all valid questions. So there's a lot to digest there. But it's definitely multifaceted.
Right. Yeah, absolutely. That was a really great answer. Thank you. I think 1 in 4 is a really staggering statistic, especially I was reading that 1 in 8 people who have had COVID-19 will be diagnosed with a mental illness. I think there's so much we don't know about this itself, and because it's really self-isolating, like you said, there were a lot of people reaching out. So I think that, that in and of itself is really kind of, made people feel secluded or not want to reach out.
Yeah, I mean, isolation just doesn't do well for really anybody. And that whole thing is, even if I'm isolated, I don't have a lot of people to talk to. But
Mm-hmm.
then if I'm going through something mentally or behaviorally, will my family and friends even want to talk to me about it? And then where do I go to get that person who's third party that might be more of an open ear? There's a lot going on. It's
Yeah, there's a lot to
definitely
break down.
yeah, it's definitely complex.
Yeah. How do you combat that stigma, or when people come to you, uh,
Yeah.
how do you kind of make them feel comfortable to open up and not feel just like a label or feel alone?
Yeah, there's a few things we do. One, it's kind of a simplistic answer, but the first one
Mm-hmm.
I'll throw out there is, if it's an agency referring to us,
Mm-hmm.
they're probably gonna have a relationship with the person first. That can
Sure.
be a nice gateway. Hey, I'm gonna fill out the referral form with you. Hey, I'm gonna tell you about them. You're talking to someone who you already know, right? So
Right.
that's a way to mitigate it. But what we do, um, one of the things that we do is we let people choose the practitioner. Our referrals department will give a list, and
Okay.
some qualifications and different things. So it's never just, hey, we're throwing some at you don't know. We don't, if you have specific things you're looking for, we can match that as well.
Mm-hmm.
Um, which is really nice because we have around, well, how many do we have right now? About 70 practitioners licensed across the whole spectrum.
Wow.
Yeah, so
That's awesome.
there's someone for everybody. There's 4 different languages: Portuguese, Creole, French, Spanish, English.
Mm-hmm.
There's literally a good match for everybody. And then the second thing, continuity of care. So, okay, I found somebody I like. I probably have 5, 10, who knows, maybe more, usually 5 to 7 months worth of appointments with somebody. Am I
Mm-hmm.
going to have that same person again? You are. So there's a bit of that relationship there, which is nice. Um, and even that first call is usually just an introduction, getting to know somebody. The another thing too is we have tech support. Um,
Okay.
if the technology is a bit of a barrier, it's usually not anymore, to be honest with people, but every now and then it is. We have people available that can talk to somebody, whenever they need it, walk you through it. We can demo with somebody if we need to. Generally, it's usually pretty easy once they try it out. That stigma tends to go away. I think probably, and then just how we market and how we talk about things. We're really, going back to what we talked about, how's the pandemic been a challenge? Having to staff up a lot. I've been working on a lot of things lately where, how do we communicate our brand? What kind of educational materials do we put out there? We're going to be redoing our website probably later in the year. So it's just really looking the part too, but it's straddling that line of, okay, we want to look big and like a solid organization, but we also want people to know they can get in touch with somebody, that we're not just corporate vertical where we don't really know you. So that's
Right.
and the last thing I would say, people like to say, well, what's the evidence, right, of
Mm-hmm.
how you break down that trust barrier? Our no-show rate's around 10%. So
Wow.
that's something we really like to put out there.
Mm-hmm.
I don't remember what it was before we went remote. It was a lot higher, but 10% is very low. So that to us is kind of the golden, this is working, right? And
Mm-hmm.
going back even to the telehealth, even if they're apprehensive at first, it builds trust in this unique way. And it's something we didn't even think of at first when we first jumped into it. But when you're seeing someone in the home environment, it makes a huge difference for the practitioner and for the person receiving services. I'm not going to an
Right.
office. I'm not missing work. I'm not using gas money. The person's here with me. We have really flexible hours too. So I think being able to tailor counseling to someone's schedule is huge. Hey, listen, it's 8 o'clock on a weekday at night. We can have an appointment, right? So we're not pigeonholing someone into saying you can only see us XYZ time. So the flexibility to can help a lot.
Wow, I definitely think that's huge, kind of making that first contact on the phone, that sort of warm transfer, I think offices can feel sterile, and then meeting them, like you said, in their environment. Because I think, you know, especially with mental health, it's pretty easy to make excuses, a reason not to go or not to do something. I think that's again, touching back on this stigma of it is, if find any reason not to reach out. So I think that's an incredible service that you offer. Can you speak about why you think Mental Health Awareness Month is important?
It kind of goes back to everything we've talked about, right? To me, and just personally, it's the most underrepresented. I don't know if healthcare is the right word, but and I don't know if issue is the right word, but issue or thing in healthcare, right? Like I said, 1 in 4. The stats could be higher on that, obviously. I mean, you can point to a lot of things, right? Suicide being the second leading cause of death for people under the age of 34, depression costing the U.S. over $200 billion annually. This stuff is going on, right? And it's not detected. It's not talked about a lot. To me, it's two things ultimately why it matters for myself personally. It gets people more comfortable, and having those discussions and being able to interact with people better. When you're able to say to somebody, "Hey, this is who I am," irrespective of how that person responds, but if they respond to you with grace and if they respond to you with understanding, it just takes the weight off your shoulders, right? Because that's kind of where the rubber meets the road, right? I can get counseling for a long time, but what does my community around me think? So it's important to educate people. It's important to let people know they're not alone. It's important to let people just be open about it. I think it just takes a huge weight off people's shoulders. And we talk about this and this and the body, right? It's easy,
right?
But so much is here, right? And so much we don't even understand yet, right?
Yeah.
And why don't we focus on that more? It's just a question I always pose to myself. So it's getting people, allowing people to be comfortable in who they really are, and not being ashamed of something that's going on upstairs, right? So and just getting people aware. I think the more you put out there about different topics, I just think the better it is.
Yeah, absolutely. I mean, I think you said it, education, and just getting people to have a conversation about it is really important. It makes it, if people can see themselves represented, in media or somewhere else, I think that's huge.
Yeah, absolutely.
And so tell us a little bit about what you have going on this month.
Yeah,
Mental Health Awareness Month.
Yeah. So we have quite a few things. This is probably one of the first times we've done a huge push for the month, and we're going to be putting out content every week on social media, quite a bit. Each week of the month is going to feature kind of a different program that we have. So I think the first week we're doing adoptions, child well-being, then we're doing the Grove, we're doing outpatient telehealth, and we're doing prevention programs at the end. So what's going to go on those weeks? Just some informational pieces about what we do, but also some stats related to those things. So if we're talking about Child Wellbeing Week, we're going to talk about us, but we're also going to talk about, a lot of statistics related to adoption and placement and things like that, getting people aware of that. And the same thing for the other weeks. And then we have 3 special events, of which ClinCloud is a part, all virtual. We have a talk going on for Advent Health staff internally on the 6th of May. We're going to post the PowerPoint in a narrated format from that to the general public after. So it's kind of a closed presentation, but it's a fun one. We want to get out there. That's about compassion fatigue. We have a virtual presentation open to the general public with the American Heart Association Orlando chapter, food and mood, nutrition, heart health, mental health, kind of a cool topic, interesting one.
Oh, absolutely.
And then we're going to be talking about mindfulness with ClinCloud. So exciting. We've got I'm going to have to pull up the URL here because I don't have it memorized. But,
That's okay.
if people want to find out more, they can just go to our website. If they click on the events tab, it just says Mental Health Awareness Month on the drop down. They can click that, or just go to empowerfl.org, IMPOWERFL.org.
This is the point. It'll be flashing on the screen right here. Click here.
Yeah,
I'll put that.
/events/MH Awareness Month. So, and then just look for us on social, right? You will find out about it. So, it'll be a fun month. The last thing we have going on, we have an illustrator and comic artist named Lucy West. She just graduated out of UCF. She's a wonderful artist. She is doing comic art for us every week of the month on social media. She's on Instagram at LucyBlue98. We're going to share her stuff around. So we're going to be telling stories about Empower programs through comics. So really cool stuff.
That is such a cool medium. I really, really love that. That's awesome.
She's doing a good job. It'll be on the lookout for him.
Yeah, I think any sort of art form that you can educate in, that's incredible. Yeah. Is there any last thing you want to say about Empower?
Yeah, I love working for Empower. It is. I think for us, it's just, for me personally, it is just a fun organization to be a part of, because we always have a phrase from the top, from the CEO down. We take our work seriously, but we don't take ourselves seriously. And it's very much this culture of, we're dealing with heavy stuff all the time, and we take that really seriously, but we're extremely flexible. We're extremely open. We love working with partners. We love working with clients. And it's a fun nonprofit to be a part of. I enjoy it. I like it a lot. I would say if anybody is needing any help in the mental health space, look us up, go to our website, give us a call. And the last thing I would say is we still have quite a bit of funding left for free services for people that have been affected by COVID. You have to be underinsured or uninsured and at or below 150% of the poverty level. Okay. But if you check those boxes, it is literally everything we do, including electronic prescriptions, for free. So so that's really, really important. But yeah, great organization, do great stuff. I mean, we served over 9,000 last year, so it's awesome.
Yeah, absolutely. I mean, I think you can just tell, by your demeanor and the way you talk about it, just how much you love it and how awesome your team is. So really excited to work together. Thank you so much for talking with me today and for sharing all about Empower and about Mental Health Awareness Month.
Yeah, absolutely. We appreciate y'all at ClinCloud, and look forward to doing some future things together. And just thank you as well for the opportunity.
Yeah, absolutely. Well, bye, Jeremy.
All right, take care.
Bye, you too.